So you come into an A&E. First of all, almost all the A&Es I know in Nigeria, in teaching hospitals and stuff, they don't have anything stocked there. There's nothing stocked there. Okay, so when you come in, even when it's an emergency, you will definitely have to bring the resources to get, we need to fix a cannula, we need to put some drugs, there are just emergency drugs we need to do, you need to get a scan. When you stabilize the patient, getting a scan, I'm a brain surgeon, so getting a scan, for example, so that's an emergency. A scan is averaging roughly somewhere between 75 to 100,000 and stuff like that. So a patient comes and say, they said I should deposit. Okay, so what do you want the doctor, the nurse, or whatever is there? How do you actually want them to treat you? How are they actually going to treat you? And I think this is really important, because I want this to actually really go out. Because Nigerian citizens must know that these are the realities. And so that they can point their fingers in the right place.
Welcome to Unfiltered, where we say it as it is. I'm your host, Emanuela Okechukwu. Today, we are putting Nigeria's healthcare system under the microscope. How does it truly compare to international best practices and global standards? Are we even in the same league or dangerously behind? Across the country is a familiar and heartbreaking story. Emergency patients turned away at the gates, women in labor abandoned, accident victims told to go elsewhere or come back with payment even before treatment begins. Lives are being lost, not because help isn't available, but because the system is broken. But is it the same story elsewhere? How do other nations handle access, emergencies, and accountability in healthcare? Today, we will unpack the brutal truth, explore the gaps, and ask the hard questions. What exactly are we getting wrong? And what must change to save lives? To help us break this down is Dr. Douglas Emeka Okor, who is a consultant neurosurgeon, Nigerian health sector reform advocate, entrepreneur and change agent who initiated and is propagating the mantra, the Nigerian patients are worth it. You're welcome to Unfiltered, Doctor.
Thank you for having me, Ella, and thank you for having me per Second News.
All right, Doctor, let's start from home. Right? How would you describe the Nigeria's healthcare system as it is?
So Nigeria has a very weak and broken healthcare system. Very simply put, clearly in your introduction, you talked about lots of the issues that we have within healthcare. So just for short, Ella, I will just describe it as a very weak and broken health system that needs lots of work put into it.
Okay. When you look at the healthcare system, like the way you've explained it, what standards do you think Nigeria healthcare system needs compared to other systems in the UK? I'm sure you have you've had experience in the UK because, well, you studied in the UK.
I trained in the UK. Yeah.
Yes. So what standards do you think Nigeria's healthcare system needs compared to other countries' system?
So I think let me start this way, Ella, because usually when I talk about healthcare in Nigeria, I'm very passionate about healthcare in Nigeria. That's why I moved all the way from the UK, where I trained to become a brain surgeon, and came back to Nigeria to actually push the standards that we are talking about. So the key thing, first of all, when you look at healthcare in a country is where do the different levels of key players within a state, within a country, where do they put healthcare in the first place? So for a very long time, Ella, in Nigeria, as a priority, in terms of looking at our priorities in terms of different sectors, healthcare has not been put as a mainstream priority, okay? Yes. One of the key things I always say is that you only put your muscle and your resources into things that you think as an individual, as a community, as a state, as a province, as a country, you only put your resources. Our resources doesn't just mean money, it means your energies and everything. So for a very long time, we've not done that in Nigeria. Now, if you're talking about, for example, where I'm coming from, the United Kingdom, and comparing with Nigeria, or even just going out, looking at comparing standards, and because in your intro, you talked about standards and in terms of international best practices, okay? So when you look at different elements of a healthcare system. Okay, for example, healthcare is a system. Okay, yeah. So healthcare has about 6 components within or elements that make up the healthcare system. Number one is what we call governance leadership. Okay. And number 2 is funding and financing, the money that you actually put in. Number 3 is the healthcare service delivery itself. So in Nigeria, for example, we have 3 levels of care. We have primary level care, we have secondary level care, and we have tertiary level care. I'll probably expand on that later. Of course, extremely important in terms of looking at those components is the healthcare workforce, what we call the human resources for health. All these doctors, nurses, pharmacists. So that's another component. Another very, very important component, Ella, is medicines, vaccines, and consumables that we usually use in healthcare, and of course things like healthcare management information systems, things like technology and stuff like that. I always add that you also need research development, monitoring, evaluation, and auditing and stuff like that. Okay, so in terms of the energies, in terms of the focus, in terms of the prioritization, okay, of all these elements of the healthcare, we have not done well in a very, very long time. So in terms of comparison, I'm just going to do a general comparison. let me put 3 different levels. So let's look. The first level is countries like the USA, the UK, Australia, Canada. Okay. Second one is countries like maybe Indonesia. Okay, Indonesia has a population of about 280 million. We are probably tending towards 230 million people. Okay, and then let's look in Africa, a country like Rwanda, and probably a country like Ghana. Okay, so if we compare these 3 different kinds of countries, okay, the first one, they are the high income countries, the USAs and stuff like that. So USA, for example, they are relatively mixed in terms of the structure of healthcare that they actually provide. It's more of private healthcare in the US. Okay. In the UK, it's public healthcare. They call it National Health Service. That's where I actually trained. Okay. In places like Canada, Australia, and stuff, it is more publicly funded, just like UK as well. Now, in these countries, the structure is mainly centralized in most of these places, but they also devolve some level of autonomy to the different like local governments or small provinces and stuff like that, and they make sure that they are bottom heavy. So their primary level care, or that level of healthcare that provides basic healthcare for people, is also very, very strong. In terms of funding, most of these countries have roughly going to about 10% of their GDP going to health, and their GDP is much larger than Nigeria's GDP. Much larger than Nigeria's GDP. Nigeria spends roughly about 3% of its GDP to health. Nigeria has, in terms of a system or the structure, it has a mixed healthcare system. So it has both public and private. Okay, and then it has like these 3 levels that I talked about. So in terms of funding, in terms of structure, Nigeria's structure is relatively okay, but the funding is very, very small. Very, very small, looking at the population and looking at where we need to actually put healthcare. Then if we look at things like the healthcare workforce, for example, the healthcare workforce in these other climes that talk to other countries, the healthcare workforce are well looking after. They have very good numbers. In fact, they even attract people from other places. People even come from other places into like all these countries I talked about, like the Canadas, the Australias, the USA, and the UK and stuff like that.
Sorry to cut you, sir, but out of all these components you mentioned in Nigeria, where do you think needs the much work?
All of them. All of them, because all of them are very, 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 very important, and they are also very poor as well. In terms of outcomes, the outcomes in Nigeria in terms of the quality of life is also dismal as well. Okay, so for example, when you look at things like life expectancy in Nigeria, definitely less than, you're going to be saying, definitely less than 60 years. Okay, but when you look at all those other countries, 80, 81 years, 83 years.
They live longer.
Yeah. Okay,
longer.
So but now let me compare with places like Indonesia, Ghana, and Rwanda, for example. Okay, in terms of the funding, for example, we have the National Health Insurance Agency Act here, where you're trying to make sure that you reduce the out-of-pocket spending for when people actually access healthcare and stuff like that. Here in Nigeria, it's definitely less than 10% of the population, and it's actually even mainstreamed towards people within the formal sector. A significant number of Nigerians are outside the formal sector, isn't it? How many Nigerians work for federal, state or local governments? Okay, so a significant number are out. But when you look at a country like Rwanda, for example, they have almost 90% capturing, okay, of their population in terms of their healthcare insurance. Ghana started not too long ago, and they're really pushing. They're roughly about 40-50% now. We are still struggling with less than 10%. Okay, so the key question will be, why is it that from a structural point of view, from the point of view of funding, from the point of view of things like looking at even the outcomes, the healthcare outcomes, when you look at things like maternal mortality, for example, women who die during pregnancy and stuff like that, Nigeria has one of the highest in the world. In fact, probably the highest when you look at the population. Okay, probably the highest in the world. Okay, so when you look at outcomes, you look at all that, you see that we are struggling. When you talk of comparing Nigeria with countries within Africa, okay, countries like Rwanda that I've just talked about, like Ghana,
Yes.
okay, and then when you look at the when you look at the population of Nigeria, and you look at, for example, when you go back to maybe to the 1990s, and you compare countries like Nigeria and Indonesia, who are literally comparable, and you look at the outcomes, you look at the investment in healthcare, you look at how they take healthcare seriously and stuff like, you will see that in Nigeria, comparatively, we have not done well at all.
Do you think Nigeria has even done anything, the country and the governance first, as the one of the components you mentioned, have they even done anything at all to see?
Well, so I think, Ella, that question is a little bit harsh. When you say done anything at all, of course, they would have done some things. But what we are saying is that it is nowhere enough. We have not even started. We've not even scratched the surface. So we're not going to say, oh no, they've not done anything.
Let me rephrase my question. Yeah. From what they have done already, have they done anything more to improve, judging with, what other countries and neighboring countries in Africa are doing?
I think I've sort of already answered that question, but I like the fact, Ella, that you're asking me again so that I can actually dig in, okay? So clearly, when you make comparisons with, sometimes people say, oh, how can you compare Nigeria and places like UK and US? Oh, they are far ahead. Compare us with at least people who are within our range and stuff like that. So that's why I've actually brought Rwanda, Ghana, and Indonesia, isn't it? Yeah. We are not doing well at all. For a very long time, over the last 40 odd years, we've not invested in healthcare. We've not taken healthcare seriously. We've not prioritized it. From a philosophical and from a cultural point of view, we do not have that thing that I actually call, the value for human life. It's a philosophy, okay, that guides, that guides a nation, that guides citizens, that guides people who actually, lead a nation. Okay, so if you look at all those countries, those developed economies, for example, and even look at countries like Indonesia and Rwanda now, you can see that from a political and philosophical plus a socio-political point of view, that they already understand the importance of healthcare. One of the things I say is think right, act right, and you will spend right. The thinking in Nigeria when it comes to healthcare is abysmal, okay, from a philosophical point of view. And like I said earlier on, you only put your resources and your muscles to things that you think that are important. And I'm telling you, Ella, I'm telling you this now, that when I say Nigerians, in Nigeria, we don't take healthcare seriously, I'm not just talking about just the government. I'm talking about every strata of our society. Okay, so for example, one of the latest people I'm going to be really taking on now when it comes to my advocacy or healthcare, guess who it is? It's the fourth estate of the realm, the media. They are not doing well at all. What is the media for? The media is for informing, educating, entertaining, and also for setting the agenda as well. What we see within the media space in Nigeria is a situation where, VDM EFCC has arrested him and stuff like that. Are those things important? They are absolutely important. But also, the media has the God-given responsibility to be able to set the agenda. Yeah. Okay, there's what they call the Sustainable Development Goals, Ella. Okay, there are 17 of them, and it was the United Nations that actually captured that. And in terms of in a visionary looking forward, where they say, okay, if a country or a people want to actually develop, these are the key things that they must look at and that they must mainstream. And they now enumerated 17 of them. Guess where healthcare is, Ella? In these 17, it is number 3. Okay, it is that important. And number 4 is education. So sometimes when I actually talk, people are like, well, Douglas, you talk too much about this healthcare. There are other key things that are really tying us down in Nigeria. And I said, yes, there are key things. So what are the key things that are tying us in Nigeria? So we can start enumerating them. Number 1, security. Okay. Number 2, infrastructure, especially power. Number 3 is healthcare, and number 4 is education. Okay. So look at the settings now. Again, going back to the media. Okay, now what are the things that are buzzing now when it comes to what's trending within the media now? Okay, the politicians are talking about 2027 and stuff like that. Now the key thing is that if all strata of society and all the key players who should be understanding that healthcare is important, okay, is this not time now? If the politicians want to start talking about 2027, I remember even for the 2023 election, I kept asking, even in my small area of influence, I kept asking, hey, the 3 key contenders or 4 key contenders for this office, what is your strategy for healthcare in Nigeria? Do you know that even key players like healthcare professional associations, we're not even asking the questions? That's how bad it is, and it's actually annoying. Okay, healthcare is extremely important, even from a socio-political point of view, from an economic point of view. It's extremely important, Ella.
Well, for that, regarding the people doing the campaign, do you think the Nigerian citizens don't help them? Because, Nigerian citizens during election, they're like, there are things they look after them, giving them that are not very much important. So how do you think the citizens would help push for them to know that these are the important things we need?
So unfortunately, from a citizen participation point of view, in this part of the world, we are struggling. And why is that? Okay, you have a very large population that when it comes to the issue of having that thinking capacity, that ability to that knowledge base and stuff like, you are struggling. You have a very large number of people of people within this space in the populace in Nigeria that are ignorant and are very poor. Okay, that's why sometimes we talk about this issue of what do you call it, poverty and ignorance and weaponizing it. Okay, now the key thing is that's why I always add when I talk about these 4 key things that we must mainstream. Okay, education must be there. And so, and funny enough, when I talk about healthcare and education, guess where I'm even mainstreaming, where I'm putting and digging in? It is the basics. So I'm not even talking about the big stuff, the basic stuff. Okay, imagine in Nigeria where your primary healthcare system actually works, where your grandmother in the village and stuff can walk into a primary healthcare center and it actually truly functions, and all the fundamental issues of preventive, promotive care is actually installed. That means you can actually, because first of all, healthcare, even providing healthcare is very expensive. And whether you like it or not, we're a low income country. Okay, we have a significant large population of people who are very, very poor. 133 million now plus. Because remember that statistic from National Bureau of Statistics in November 2022 said 133 million multidimensionally poor people, isn't it? Since this government actually came in, of course, that's not going to be plus. Significantly more people have actually entered poverty and stuff like that. So in that kind of situation, you need a primary healthcare, because there are 4 strategies for actually providing healthcare. There's preventive, promotive, therapeutic in terms of, let's treat them, and then there's rehabilitative. Guess the cheapest in this 4. It is the promotive and preventive care. Let that old woman in the village, let's prevent her from having a stroke or having a bleed in the brain or having a heart attack. Let's actually prevent it, because when it happens, those people in the village, now farmers and stuff, they don't have the money to come to your teaching hospitals and stuff like that to actually. So let's prevent it. That's why your basic healthcare system must work. Okay, and of course your basic educational system must work as well, because it is when from that primary school level where even in the village where you have primary school teachers that are paid very well and they are teaching proper stuff, they build the philosophy of how people think. Okay, then you won't have people driving anyhow on the road and stuff like that. It starts from just how you actually build up the minds and actually create a particular philosophy and the way people actually behave and think and act.
Thank you for that. Before we go into the patient's experiences, because of course patients experience different things, they have different experiences in these healthcare systems, right? Before we go into that, I'd love you to shed light on the three systems,
3 levels of
primary, secondary, and tertiary.
So the primary level care I've just sort of talked about, and I said it is the bedrock. Okay, in Nigeria, realistically, we basically do not have a primary healthcare system. Okay, you have it on paper. Okay, that's unlike if I need to throw this in. When it comes to the issue of white papers, policies, legislations, laws, we are fantastic, we are very intelligent. When it comes to having the political muscle and the will to actually translate those things, those very nice things in paper, into things that will actually impact directly on the lives of people, and people will say, oh yes, you understand, we are trying, at least we can see some movement. It is zero. Okay, so look at places like Ghana, Rwanda, and stuff like that. They have policies as well, just we have policies, but they actually truly implement them. Okay, remember, think right, act right, spend right. But because the thinking of people within our political space and our ministry departments and agencies, the thinking is not right, they will definitely not take the right actions, and of course they won't spend right. So there's a primary healthcare system which is almost non-functional and stuff. Okay, so that primary healthcare system normally should be mainstreamed and pushed by the local governments within Nigeria. Remember, I have 774 local governments, isn't it? The local governments are extremely weak. Okay, extremely weak when it comes to actually providing governance, looking at the issues of providing service, how you actually tackle the issues of manpower and healthcare resource and stuff like very weak. Okay, we know that last year there was this Supreme Court judgment that that they should be autonomous and funded and stuff that we still wait to see. And remember, I said implementation usually is a problem, isn't it? So that's the primary care level. The secondary care level, for example, we are in Abuja. I like using real examples. So in Abuja, for example, you have hospitals like Maitama General Hospital, Okor General Hospital, Wuse General Hospital, Kuba General Hospital. Those are secondary level facilities. We usually call them general hospitals. Those are usually mainstreamed by the state governments. Okay, so let me go back. The primary care level is supposed to be mainstreaming preventive and promotive healthcare, a little bit of therapeutic. It is just the basic stuff that you're actually trying to actually do. Okay, now by the time your primary care level cannot provide you an individual patient or whatever has a medical issues that are now above the capacity of the primary level, then you should be referring them to secondary level. So in secondary level, you have things like general surgery, things like obstetrics and gynecology, giving birth, some kind of specialties. There's a little bit of specialty. There's specialty care there and stuff. Then you now have the tertiary level. Okay, the tertiary level is where you actually provide complex care for patients, okay, and those are the teaching hospitals and the federal medical centers. Now and again, you see a good number of state governments say, oh yes, we also want to provide tertiary care as well, okay. You see a state government that is supposed to be mainstreaming their general hospital and supporting their local government to make sure that the primary care level works, but they start building big buildings and stuff like that, and they say, oh, this is specialist hospital and stuff, and at the end of the day, they go commission, okay, they go commission something, and everybody claps, and at the end of the day, it's not functional and nothing is really happening. Okay, that's another key thing I must state here as well. Okay, building things and building things up and down is not equal to actually providing healthcare. Okay, providing healthcare does not mean a building. It doesn't at all. If you want to provide healthcare that is worth its salt, that has the fundamental underpinnings of safety and at least some level of quality and stuff like that, all those components that I talked about, you must actually focus on all of them, okay? Not just building things. There seems to be a tendency for these white elephant projects and wanting to build things and commission them and stuff. One of the things I always say, Ella, is that people deserve the kind of leaders that they have. The average Nigerian person is usually inspired and really wowed, okay, by buildings and things that are physical and stuff like that. Meanwhile, one of the significant drawbacks of our healthcare system and our systems generally in Nigeria is that we do not invest in people. Okay, we'd rather take money and be invested. For example, even in FCT, some people say, this one they are building roads, and so look at the road, the flyovers they are building. And I say, okay, that's nice. Thank you for the road. Well, let's go and look at the primary healthcare centers. Let's look at the primary schools and stuff like the public primary schools. So it's a big issue. Before I asked the last question I said, to bring us to the patient's experiences. Now, with from how you explained it, I think the secondary and the tertiary are the ones who take care of the emergency care problems. Normally, they should. That should be their forte.
So why is it that patients go to the hospital and they are being referred? They are telling them that, emergency care, that's why it has the name emergency. They are telling them they can't do this. They are telling them to bring... The most annoying one is a deposit. A patient is there maybe from an accident, gunshot, or they're telling them to pay money first of all before they even take care of them. Okay, so when the first question you asked me when we started this interview, Ella, was how will I describe our healthcare system? And what did I say? It is weak. Okay, extremely weak. So for a system that is weak, what output are you actually expecting? Okay, so remember I talked about the social health insurance scheme. Okay, where I said less than 10% of people are captured and they're mainly in the formal sector. Okay, more than 70 to 80% of people pay out of pocket. Okay, and they pay out of pocket for whatever level of care that they want. Primary level care, secondary level care, and tertiary level care. Okay, now again, one of the things I also said was that when it comes to white papers, things of paper policies and stuff, we have them a lot. For example, you have the basic healthcare provision fund, okay, that is supposed to be 1% of the consolidated revenue, okay, from the federal government. 5% of that basic healthcare provision fund is supposed to be going to emergency care in terms of pre-hospital care, ambulances and so that's what they call the Nigerian emergency ambulance service or something like that. Okay, and part of that, those resources are supposed to actually be going to some specific
tertiary hospitals where if a patient comes in and there's no money and stuff like that, they can actually start the first things within the first 48 hours, and that covers that. Ella, I'm stating very clearly to you here now, okay, on PSN, that there's nothing like that in reality. Absolutely nothing.
But do other countries, neighboring countries you mentioned, they have that in place?
Yeah, they do, and it is implemented. Okay, so let's come down to reality. I like reality. I don't like theory and stuff like that. Okay, so you've given examples of people who will go to hospital and they say, oh, bring deposits and stuff. Okay, so let me use, I'm in Federal Medical Center, Abuja. Okay, so remember I said that fund does not exist. It exists only on paper. Okay, so you come into an A&E. First of all, almost all the A&Es I know in Nigeria, in teaching hospitals and stuff like that, they don't have anything stocked there. There's nothing stocked there. Okay, so when you come in, even when it's an emergency, you will definitely have to bring the resources to get, oh, we need to fix a cannula, oh, we need to put some drugs, oh, there are just emergency drugs we need to do, oh, you need to get a scan. When you stabilize the patient, getting a scan, I'm a brain surgeon, so getting a scan, for example, so that's an emergency. A scan is averaging roughly somewhere between 75 to 100,000 and stuff like that. So a patient comes and say, oh, they said I should deposit. Okay, so what do you want the doctor, the nurse, or whatever is there? How do you actually want them to treat you? How are they actually going to treat you? Yeah. And I think this is really important because I want this to actually really go out. Because Nigerian citizens must know that these are the realities. And so that they can point their fingers in the right place.
Someone might walk in and say, these people are not attending to me, but it's just that they don't have what to attend to.
They don't have what to attend to you with. So you actually have to go buy all those basic things that you need to actually attend to your emergency. Extremely important. You must know this.
I should wrap this up. Your advice will be important. What word of advice, what's the way forward you think this can adopt to?
It's very simple, Ella. Do you understand? The different stratas of our society. Okay, and I'm going to mention, but there are some key ones. Remember, I said because of the poverty and ignorance, and so a significant number they will healthcare. What's healthcare? Healthcare is not important, but the key ones that have the key eggheads, the health professional associations, okay, civil society organizations, faith-based organizations. I always draw in the Nigerian Bar Association. Okay, they are a very key and strong organization. All other key partners, governments at national and subnational level. Okay, the MDAs. Okay, the national and state assemblies and stuff like that. They must know that healthcare is extremely important. Okay, and then they must now start to mainstream it. Okay, understanding that, man, for any country to be respected, even from the point of view of just respect, global respect and stuff like that. If you have a weak healthcare system, nobody will respect you. That's the truth. So it needs to be mainstream. Oh, I'm forgetting a particular key player, the media. The media, please, they should start mainstreaming. They should set the agenda. Okay, they shouldn't just say, oh, because the truth is that healthcare, so generally seems to be a boring discussion and stuff like that. So, but because I'm pushing for to the point where the media in Nigeria knows that, oh, healthcare is so important, even though people are not discussing it, we can set the agenda and make sure that that becomes something, a key thing that we're actually discussing. And we need to do this, Ella, because like I always say, the Nigerian patients are worth it.
Thank you so much, Dr. Emeka, for that very wonderful insight.
Thank you.
A lot of we learn every day.
Mm-hmm.
Thank you so much for joining us. Please don't forget to follow, like, and share this very important episode. See you next time on Unfiltered. Bye.